Hello everyone, welcome you all of this course United Nations Sustainable Development Goals. In this module we are going to discuss SDG 3, that is good health and well-being. So we began at eradicating poverty and then eradicating hunger, and then the third most important thing comes, that is about good health and well-being. So let's see some facts. An additional 18 million health workers are needed primarily in low and lower middle income countries to achieve universal health coverage by 2030. 18 million, 180 lakhs. Well, why this matters? So if you see, like there are basic three needs. This has been a long like a propagation in all the cultures, in all the countries. It is like a given that any person requires food, clothing and shelter, right? So in this one, if you see, food, clothing, shelter, these are the basic necessities, and after this definitely it is like a good health, good physical health, good mental health, so that one can perform or live their life at least like happily. Otherwise, if there are like a health issues, if medical conditions, some kind of disease, that's a very troublesome life. Depending upon the scale and extent of it, one experiences the gravity of it, right? But why it matters, let's see. What's the goal with this SDG? To ensure healthy lives and promote well-being for all at all ages. So it covers all the humans at all their ages, wherever they are. Well, why? Ensuring healthy lives and promoting well-being is important to building prosperous societies. If one is not able to maintain a good health, one cannot concentrate on any other work, whether it is learning, work, personal life, family life, social life, any of these things. Even it may challenge you to do your own routine activities also, if the like a situation is like that, right? So at least it hinders in some way or the other. However, the COVID-19 pandemic has devastated health systems globally and threatens already achieved health outcomes. Another problem, like whatever was achieved in all of these years and decades is getting like a challenge by COVID-19 and its impacts. Most countries, especially poor countries, have insufficient health facilities, medical supplies and healthcare workers for the surge in demand. The pandemic has shown that in rich and poor countries alike, a health emergency can push people into bankruptcy or poverty. So irrespective of your position and place, if you are attacked by like any health related issues, you are going to experience similar kind of situations, similar kind of challenges, whether at personal level, family level, social level, occupational level, any levels. Okay, so it doesn't matter where you come from. When the virus like COVID-19 actually stuck, people from most of the countries, but perhaps all of the countries, in all of their corners of the world, they got impacted somehow or the other, even health wise also. So in the last 3-4 whatever surges have happened in depending upon the like a country, most of the people have experienced in their own family, if not in family, then at least in the neighbors, right? So the potential of like such damages, such catastrophes, is experienced. The world has seen of like such a medical emergency if it arises, right? Concerted efforts are required to achieve universal health coverage and sustainable financing health, because there should be like a financing. Otherwise how are you going to like a fund all of those efforts and like a things. Address the growing burden of zoonotic and non-communicable diseases, tackle antimicrobial resistance, environmental factors contributing to ill health, etc., etc. So if you see, there may be like a types of like a diseases. So one mention, it is found over here, like a non-communicable, zoonotic, right? Antimicrobial resistance, like you may be aware of like a superbugs, so some of the like these microbes, they are getting resistant to the antibiotics, and now they are termed as like a superbugs. So they can, you cannot kill them even with the like the present set of medicines. Okay, so what goes next? If they become resistant to it, if they develops resistant like a abilities, power, okay, then how do you tackle them? Right, so this will become the problem gets squared, right? You have to look for like a totally different means. So one of the best means is to stop contracting like those kind of like agents at all. And so if you are able to do that, definitely a great number of like lives can be saved, or like such situations can be saved. Well, what progress have we made so far? Progress in many health areas, such as in reducing maternal and child mortality, like we have seen in the previous lectures, how over the years, mortality and like infants, like a death and all of those things are gradually coming down. Well, it has not come to the zero yet, but yeah, there is a progress. There is like a like some heartening like a situation that yes, there are some proofs that it can be controlled, and gradually the world is able to bring that number down. And I'm sure like in the coming years and few decades, and I'm sure like we'll be having a good command over it. In increasing coverage of immunization, okay, immunization is another like a man-made like a strategy where we increase like our bodily abilities, this immunization, this ability. By immunization is like a process you may be aware of. Mostly it is given by like these syringes across the world. Since the childhood only, like we have experienced several types of like vaccinations given, like cholera, TB, hepatitis, like malaria. There are several through which one can save like even flu, right? So these like antibodies are already kind of like by these vaccines are given in the human body. So whenever the main virus, bacteria, if you come in the contact of that, okay, there is a good chance that your body is going to like fight it nicely, and you will come over, you could recover very easily. So there won't be much of impact, or the first place you may not be able to get that disease also. So that kind of abilities. So when there are 8 billion people across the world, it is a very difficult like a challenge to help everyone with this immunization. Well, in India itself, we can talk about our own country. For the last several like decades, polio eradication particularly, you may be aware, once or twice a year, like on the typical Sundays, this drive is happening for a long time now. And well, it's a kind of a good news, that this like a polio related cases have come down like drastically, and there are like very few cases I think found, and in an interval of like few years. So I'm sure in few years like a time this virus will get eradicated completely. In reducing some infectious like diseases continues, but the rate of improvement has slowed down, yeah, because of the COVID, especially during COVID-19, which is overwhelming the health system globally. Well, COVID-19 has actually really tested the health system of the like countries and the whole world, like how efficient it can be, and what are like helps, and what are the like supports needed to strengthen our health like support system in case of like such like emergencies. Yeah, health outcome already achieved. How can we achieve like these targets? Then the next point comes, ensuring healthy lives first of all, because you yourself can take care of your health, because you yourself carry like this responsibility, and your own like a capacity, like you can handle on your own. Like a lot of like these diseases which are happening in this time, in this particular like recent decades, are mostly lifestyle like based, like hypertension, like diabetes, like other like heart related issues, digestion related like issues, and obesity, all of these things. If you see, these are lifestyle based like diseases. So earlier, like older times and modern times, so this is the difference. Like older times, diseases patterns, if you see, there used to be like a cholera attack, like a plague, all of those kind of things. But nowadays, mostly like this, except this COVID like incident which happened like once in a blue moon, okay, but mostly I think people are suffering with the like a lifestyle like based diseases. So this is where this first point comes, like how can we achieve this target? First of all, individually ourselves. ensuring healthy lives, and that control we have, what we are eating, and what we are doing, so all of those things all requires a strong commitment, but the benefits outweigh the cost. Healthy people are the foundation for healthy economies. Obviously, if you are healthy enough, you will be able to contribute. Immunization is one of the world's most successful and cost-effective health interventions. While vaccination coverage among infants increased from 72% in year 2000 to 86% in year 2018. Okay, so that's a good, like an increase. So at least we see now the world is, almost, like 86%, kids, by in the year 2018 were vaccinated. Okay, so rest 14%, the target is to bring them also in the fold. 19.4 million children did not receive the essential vaccines during the first year of life. 19.4 million. In fact, since March 20, routine childhood immunization service has been disrupted on a scale not seen since the inception of the expanded program on immunization in the 1970s. Okay, of course, because of, like a pandemic, a huge disruption. Does anyone have access to healthcare? In 2017, only around 1/3 to half of the global population was covered by essential health services. 1/3 to half. That means rest of the half, or perhaps 3/4, like 2/3, may not be having, like access to essential health services. If current trends continue, only 39% to 63% of the global population will be covered by essential health services by 2030. So it is estimated with all of these efforts also, it may reach, up to 39 to 63%. That means, even if the best of the efforts, it looks like, at least 1/3 or more than 1/3 of our population is not going to get, like a covered. COVID-19 crisis has disrupted essential health services around the world. Some services have been suspended to free up resources for COVID-19. You may be, like aware, there was a tremendous pressure on the health, like a system, and majority of the, like a regular, like health services were converted into the COVID care facilities. Patients, and to reduce the risk of transmission, if universal health coverage is to become a reality by 2030, growth in the provision and use of essential health services must greatly accelerate. Well, what can we do in this situation? You can start by promoting and protecting your own health. First of all, take care of yourself and the health of those around you, in your family, friends, peers, by making well-informed choices. So this is the very important part. Even though we are aware of, like most of the things, what is good for our health or not, but in practice, it gets usually neglected, right? So that negligence, one has to take care of. Practicing safe sex, vaccinating your children, because even if these kind of, like regions, if you see, are responsible for a spread of, like a HIV virus, and vaccinating your kids, like a lot of, newly born kids, die, in the first year of their birth, right? And just few months of their birth, that percentage is even higher, right? So those can be avoided, by availing like a good informed, like a decision, and reaching out to the, like a nearest healthcare facilities, or contacting a maybe a health, professional. You can raise awareness in your community about the importance of good health, healthy lifestyles, as well as people's right to quality healthcare services, especially for the most vulnerable, such as women and children. We have discussed earlier what are the arrangements made, and definitely it is bearing fruit, but yeah, still there is room to improve. You can also hold your government, local leaders, and other decision makers accountable to their commitments to improve people's access to health and healthcare. Well, you can search here for more details. Yeah, so let's see some figures related to COVID-19. Well, COVID-19 has infected more than 500 million people worldwide. Well, this is the data from mid 2022. 500 million. That's a huge number. Led to 15 million deaths. I think in the very long, like years, like a such kind of pandemic, or perhaps first time in the I think the world's history, human history, First time such a pandemic has happened, which has, touched the every corner, every country, every, like a place on this earth, of the human habitation. And somebody or the other have fallen sick, or, someone known has died, right? So such is the extent, because I remember when in the last, like 100 years ago, the Spanish flu actually stuck, like a huge number of, like deaths, have occurred, even many fold, than what pandemic COVID has actually caused. But the spread was limited to, like a certain, like a places, perhaps not entire, like all of the world, right? So what if, that has, spread across the world, even the toll was going to be not much higher. So in the last 100 years, like so much of health facilities have improved, now we are well aware of, like what are the diseases, what are the, root causes, how to treat them, medication facilities, vaccinations, all of this. So COVID itself, if you see, these vaccinations were kind of, like brought in a very short period of time, I think less than a year period, or under, like a 2 years period, and a huge number of, like a mass production, started taking place, and people, started, like getting vaccinated, right? So that's a, a great achievement in itself. Well, that was, kind of impossible, like a few decades back. But now with the current state of, like a technology and, like a things, we are able to do this. So that is, like a good side of it. Well, it disrupted essential health services in 92% of the countries. End of 2021, 92% of the countries, essential health services were disrupted. Okay, so such was the, like extent of, like this thing. You can just imagine, how bad, this has been. This coronavirus, typically it is, like represented like this, because it has, like these bulbous, like structures, crowns on its body. That's how it looks like, like a corona. That's why it is named as, like a corona. Halted progress on universal health coverage. Okay, and some more things like impact. Global life expectancy has, like come down. Immunization coverage has come down. Well, prevalence of anxiety and depression has actually risen. Like more number of people are, getting psychologically, psychically, like affected and all that. Deaths, from TB and malaria, like all of this has also risen, because if somebody having comorbid kind of, like a situation, okay, it was proven that it is, even more fatal, for those kind of people, right? So people with, like lesser immunities, people with comorbidities, and some other, like complications, they have their percentage of, deaths is even higher. Further, 22.7 million children missed basic vaccines in 2020. So that's a huge, like a number, 3.7 million more than in 2019. So all of the efforts, if you see, which are, coming from the last, several years, got, like a major dip, like during this period, right? Pandemic claimed the lives of 1,15,500 frontline health workers. Okay, this is as per the UN's record, from the year 2022. You can see the source and time. Yeah, it may have been like, little more, because we are in the year now 2023, early 2023. Yeah, tuberculosis deaths rise for the first time since 2005. So you see, the tuberculosis is a pulmonological, like a condition, is a disease, because of this tuberculosis, this virus. And well, so the data suggests, like this has been decreasing over the years, but suddenly in the year 2020, because of, like a COVID-19, this has risen for the first time, in all of these years since 2005. So if this is the year 2005, this has been declining every year gradually. Suddenly it has gone up. So this is the impact, one can, like realize, Yeah. So what it says is that ensure healthy lives and promote well-being for all at all ages. That is the motto of this SDG 3. You can see, like some picture over here. This is from Ethiopia. This lady, she is receiving COVID-19 vaccination. She is the health worker, and people are in mask. You can see this has been the kind of prevalent strategy, very effective strategy though, yeah, here in this figure we have cumulative number of reported COVID-19 deaths as of 8 June 2021. So Europe and Northern America is leading in that number. Then we have Latin America and Caribbean, then Central and Southern Asia, and then Northern Africa, Western Asia, Eastern and Southern Asia, and then Sub-Saharan Africa. Maybe for the latest data, you can check WHO's like a website. Probability of dying from any of the four main non-communicable diseases between the age of 30 and 70. The data is from 2010 and 2019 percentage wise. Light green 10, dark green 2019. So here if you see, this is the percentage given 0 to 40, and in this one we can see like this range. Well, the world's average 17.8, and yeah, the lighter one 2010, this has been 19.9. so effectively if we see, this has come down a little bit, so it's a kind of improvement, and I see that improvement is very slight here in the case of Oceania, and Central and Southern Asia, well, almost everywhere it has improved. That's nice. Yeah, excluding Australia and New Zealand, I think okay, Oceania, okay, because Australia and New Zealand is given here separately. Okay, fine. But overall if you see in the Oceania, this percentage is like a much higher compared to the rest of the world. This has reached 36.5 from earlier 36.6. So that is the most impacted region. And then the lowest, I think, among all of these is Australia and New Zealand, and that's why it is bifurcated. But it is really very contrasting that the two countries like these two have the lowest and the others together they have the highest. The rest of the world is in the middle. Then we have here incidence rate and notification rate of tuberculosis between these 2 years, 2000 to 2019, new and relapse cases per 1 lakh people. So this is the year, and here we have number of cases per 1 lakh people. So beginning 0 to up to 250. I see this dark line somewhere in the middle, 175. It looks like 175 here, and this has gone perhaps to this range, yeah, less than 150, maybe 125, close to 125. Well guys, I'm not sure, it's not the exact number, maybe we need that exact figure from the table, but yes, this has declined, yeah, till 2019. That's why the dip of COVID is not shown over here, otherwise there will be a sudden a spike. Malaria incidence rates between these 2 years, cases per 1000 people. Okay, so if you see, that's a happy side, gradually it is declining, and 2019 this has been close to here, right, and 2000 it used to be at 80 per 1000 people. Further, we have top 5 causes of death among males and females aged 15 to 29 as per year 2019. Okay, so the highest, including both the genders, is road injuries. Okay, so the biggest culprit are the transportation, related, deaths, right? And then interpersonal violence. Okay, second is tuberculosis. If you see here, in the males it is okay, it is divided into males and females. So the first one is in the males it is road injuries. Okay, it's a very laughable but ironic and directly relatable region also. I think most of us can relate these like a casual driving and like a risk taking what happens usually on the road, is the biggest, like a toll maker. If you see these road injuries, I think this should be an eye opener for all of the, like men, boys, walking and driving on the street. Then interpersonal violence, tuberculosis, self-harm, and HIV. In the females, this is tuberculosis. Okay, that is the biggest killer. And then maternal conditions, like a pregnancy, birthing related, like issues. Then self-harm comes third, and then HIV, and then road injuries. Okay, so at least in the 5 road injuries is the least for women. But in women, this AIDS wala thing is like a higher than the male counterparts. If you see, is close to double, 6.9 and 3.6. Okay. So, well, why these kind of stats are like essential, somebody might like ask. Well, this is why it is essential. Now what are the main causes, and up to the extent of it, the quantum also, like for the like deaths of the people responsible, gender wise also, year wise also, even country wise also, even state wise also, right? So as a policy maker, or even as a like an individual person, now what to take care of, right? That's why this is essential. This data statistics are most essential things, because whatever efforts you are putting in, what effort you are going to put in, and where and to what extent, how do you know? This is why. Coming to the next, we have distribution of reported COVID-19 cases and deaths by age, January 2020 through April 21 percentage. Okay, so 65 plus age group, if you see, that has the highest like a deaths among like this group, even though they have contracted lesser, if you see 13.9%, but out of that 76.4% have died. So that is the mortality rate after contracting the COVID-19 for the elderly people, senior citizens above 65 years of age. Okay, that's why this has been even like a crucial to save like people from like this category, our elderly people. Then in this, if you see, is 30 to 64. Okay, contracting, I think the 57.2%, and out of that 22.9 have like died. 15 to 29, this ratio, if you see, is gradually like decreasing very sharply. Here 57.2 to 22.9. Here it is 21.7 to 0.6. So that means young adults or youngsters, they are very much relatively safer, even if they are contracting like this virus COVID-19. Okay, it's very like a small chances that they may end up like dying. Okay, but this is very crucial. So that's why like if you remember, when the vaccines vaccination program started for like a COVID-19 in India. Okay, so the first like a set of like a doses were given to the elderly and people with comorbidity like conditions. This was the reason. Like if you are questioning, if you want to know why this happened, this is why it happened, because this was like a most vulnerable group, and that group was actually like a given the shots first. And for under 5 age, 1.6% is only contracted, and out of that only 0.1 percentage of like a under 5 age kids like they died. So this is the extent age group wise. Now we have number of COVID-19 vaccines administered per 100 people as of 17 June 2021. Well, it's a relatively bit older data, but yeah, even collecting data also is a mammoth task, but yeah, we can understand. Well, the highest we have with Europe and Northern America, as expected. Then Eastern and Southeastern Asia, like Koreas and Japan and all of them. Then Latin America and the Caribbeans. Then we have Northern Africa, Western Asia, Western Asian parts on the our like left side. Then Australia and New Zealand. Then Central and Southern Asia. Then comes Oceania, and then Sub-Saharan Africa. Okay, and the world's average stands at 31. Okay, So this is the extent of like a vaccines per 100 people. So you can call it as a percentage also. Then we have universal health coverage service, service coverage index as per year 2017. So in this one, well, regional mean is given here by this, like a light green, like a lines. It is here, here, and here. So we see, okay, this one is here, and very, I think the highest, Australia and New Zealand. Okay, this is the universal health coverage. This index is very high. In case of like these two countries, is above 80. I think close to 80, 86, 87, 88, something like that. 86 perhaps, maybe you can check the exact number. Then Europe and Northern America, different countries, that's why there are so many like these circles, and mean is here. And then mean is also I think at 80, so that means like a 80, you can call like a percentage, or like a covered. And then Latin America close to 75, 76. Then we have Eastern and Southern Eastern Asia. Then Northern Africa, Central Southern Asia, Sub-Saharan and Oceania. Okay, so Oceania has the lowest mean here, and then it is Sub-Saharan Africa. So in Sub-Saharan Africa, you can see whoever is this is the lowest, among all across the world. Here we have proportion of cases reported, report forms with missing attributes January 2020 through April 21. So not all of the data entries are filled and all this. So what happens usually, we also feel like like a careless while filling any such forms. But collectively, if you see crores and crores of people filling like those kind of forms, and if they are filling it incorrectly or they are not filling it completely, that means it will end up giving like wrong or not valid like results, or maybe like the chances of error is going to be very high, right? So giving up like a proper and full information is good for everybody, right? So you can see here the percentage is very high, 99.3, 99.6. Missing sex, missing age, that information is not given. In Africa, it's above 99. Okay, 99%. In Americas, missing age ka data is the highest, 50.5. People do not want to reveal their age, and very few people have kind of like not given like their sex related, gender related like a data, that is 2.5% only. Eastern Mediterranean 5.4, 6.3. Then Europe, Western Asia, Pacific, South Asia 0 and 0.2. Global missing age data 44.2 and gender related 8.